Femoston tablets contains active ingredients dydrogesterone and estradiol. Estradiol is an estrogen that is identical to human endogenous estradiol. Estradiol compensates for the estrogen deficiency in the female body after menopause and provides effective treatment of psychoemotional and vegetative menopausal symptoms, hot flashes, increased sweating, sleep disturbances, increased nervous irritability, dizziness, headache, involution of the skin and mucous membranes, especially the mucous membranes of the genitourinary system, dryness and irritation of the vaginal mucosa, pain during intercourse. Dydrogesterone is an effective oral progesterone that completely ensures the onset of the secretion phase in the endometrium, thereby reducing the risk of endometrial hyperplasia and carcinogenesis, which increases with estrogen. Dydrogesterone does not have estrogenic, androgenic, anabolic, or glucocorticosteroid activity. Indications: hormone replacement therapy for disorders caused by estrogen deficiency in perimenopausal women, not earlier than 6 months after the last menstruation, or in postmenopausal women. Prevention of postmenopausal osteoporosis in women with a high risk of fractures with intolerance or contraindications to the use of other drugs. How to use: inside, preferably at the same time of day, regardless of food intake, 1 tablet per day without interruption. Femoston-110 is taken according to the following scheme. In the first 14 days of a 28-day cycle, take 1 white tablet daily, from half on the package with an aroma marked with the number 1, containing 1 mg of estradiol. In the remaining 14 days, daily 1 gray tablet, from half on the package with an aroma marked with the number 2, containing 1 mg of estradiol and 10 mg of dydrogesterone. For patients who have not stopped menstruating, it is recommended to start treatment on the first day on the menstrual cycle, first day of the onset of menstruation. In patients with regular menstruation cycle, it is advisable to start treatment after 10 to 14 days of progesterone monotherapy. Patients who last menstruated more than 1 year ago can start treatment at any time. Contraindications: established or suspected pregnancy, period or breastfeeding, diagnosed or suspected breast cancer, history of breast cancer, diagnosed or suspected estrogen-dependent malignant neoplasms, vaginal bleeding of unknown etiology, previous idiopathic or confirmed venous thromboembolism, deep vein thrombosis, pulmonary embolism, active or recently transferred arterial thromboembolism, acute liver disease, as well as a history of liver disease before normalization of laboratory parameters of liver function, untreated endometrial hyperplasia, hypersensitivity to any of the components of the drug, porphyria. Special instructions: during drug treatment, it is recommended to periodically examine women. Their frequency and nature of studies are determined individually. In addition, it is advisable to conduct a study of the mammary glands and/or mammography. The use of estrogens may affect the results of the following laboratory tests: glucose tolerance, thyroid, and liver function tests. The drug femoston is not a contraceptive. Patients in perimenopause are advised to use non-hormonal contraceptives. It does not affect the ability to drive a car and other mechanisms. Side effects: from the nervous system, headache, migraine, sometimes dizziness, nervousness, depression, change in libido, very rarely chorea. From the side of the cardiovascular system, sometimes venous thromboembolism, very rare myocardial infarction. From the gastrointestinal tract, nausea, abdominal pain, flatulence, very rarely vomiting. From the side of the liver and biliary tract, sometimes cholecystitis, rarely abdominal liver function, sometimes accompanied by asthenia, malaise, jaundice, or abdominal pain. From the skin and subcutaneous adipose tissue, sometimes allergic reactions, rash, urticaria, itching, peripheral edema, very rarely chloasma, melasma, erythema multiforme, erythema nodosum, hemorrhagic purpura, angioedema. From the reproductive system and mammary glands, soreness of the mammary glands, breakthrough bleeding, pain in the pelvic area, sometimes changes in cervical erosion, changes in secretion, dysmenorrhea, rarely an increase in the mammary glands, premenstrual-like syndrome, other changes in body weight, vaginal candidiasis, breast carcinoma, an increase in leiomyoma in size, rarely intolerance to contact lenses, an increase in the cavity of the cornea, very rarely exacerbation of porphyria.